Chapter 5, Lecture 2. In the previous lecture, you learned that medical insurance has had a significant influence on the allocation of medical care resources through the out-of-pocket prices. So in this lecture, you will learn in more detail about the relationship between health insurance and the demand for medical care. There are three common features of health insurance policies that may have major impact on the demand for medical care. The first feature is the co-insurance, which is basically what consumers pays as is a fixed percentage of the actual cost, basically out of pocket, before, and then the insurance company basically covers the rest of that. Now, if your co-insurance is 20%, means that you have to pay 20% of the actual price. If the actual price is $100, you have to pay $20. If the actual price is $1,000, you have to pay $200 before out of pocket, before the insurance company covers the rest of that. The co-payment is a fixed amount paid by the consumers, is independent of the market price or actual cost of medical care. So basically, if your co-payment is, say that $100, it doesn't matter if the actual price is $10 or $100 or $1,000 or $10,000. The co-payment determines how much you have to pay out of your pocket before the insurance company covers the rest of that. So therefore, compared to a co-payment, co-insurance makes consumers more sensitive to a change in the actual market price of medical care, which is a good thing because we wanted to allocate our medical care services and product more cost effectively based on the actual market price and willingness to pay of the consumers. The third common features of health insurance are deductibles. Now, these deductibles are a fixed amount of healthcare costs per calendar year paid by consumers before coverage begins. So if your deductible is $2,000 per year, so you need a medical care, you have to pay $2,000 out of your pocket per year before you can use your health insurance coverage. So in the previous lecture, you learned how to drive demand care for medical care. Demand care for medical care is negatively sloped like any regular demand curve. So it shows the inverse relationship between the price and quantity demanded. So this a consumer's willingness to pay, which is a marginal benefit for each unit of good, falls as more of the good is consumed because of the law of diminishing marginal utility. Remember that? So how do we determine how much we have to consume? The utility maximization rule says that you have to use medical care up to the point your marginal benefit of each additional unit of medical care is equal to the marginal care of that unit of medical care. So the medical benefit determines by willingness to pay, and medical cost determines by out-of-pocket price, right? So not the actual price. So if you wanted to say that, now I wanted to go to the doctor, you just calculate how much really I need. What is marginal benefit of going to this doctor for me? Is that equal to marginal cost out-of-pocket price that I have to pay or not? If your marginal benefit is greater than or equal to marginal cost, you go to the doctor. Otherwise, you calculate and you see that it's not your benefit and you don't go. Now, what is effective demand? So when we have, just like any regular demand without insurance, the consumer's willingness to pay for medical services basically determines, that demand in each successive amount of basically quantity demanded, how much they are willing to pay without health insurance coverage, demand without health insurance coverage. So in any market, there are some consumers, they are willing to pay more than the market price. So the differences between the willingness to pay and the market price paid is the consumer surplus. So if you are willing to pay $200 right now for going to the doctor and figuring out what is your problem, and the market price is for you is $100 for going to the doctor, so basically your consumer surplus is $100. $200 minus $100 determines $100. Now, when there is a insurance in the medical care, that makes it a little bit more tricky. So the nominal demand is a demand with insurance, which reflects the total price paid for medical services, right? So this takes into account the co-insurance paid by the insured, and then insurance coverage is the gap between the willingness to pay and the actual price. So we will show that graphically. Don't worry if you don't get it right now. So graphically, we say that, okay, let's have the per unit price in the vertical axis, and we have the quantity of medical services in the horizontal axis. Now we say that, okay, without insurance, patients are willing to pay $250 for 5 units of medical services or 5 doctor visits, $250. And then so that's basically in the usual cases. Now, suppose that, so there is an insurance, medical insurance, and there is a 20% co-insurance here. So in that case, 20% of $250 will be how much? $50. So the patients, they pay $50 for 5 units of medical services or 5 doctor visits, $50. And the rest of that, $250 minus $50, $200 will be paid by the insurance company. So we can actually draw this demand, effective demand, which shows the demand without insurance. The vertical distance between the demand with insurance and without insurance basically determines the amount insurance company has to pay. So the vertical distance between the demand with insurance and the horizontal axis represents the full price for the office visit, which can be broken down into the consumers and insurance payment. From $50 is consumers and $200 for insurance payment. Now, suppose that a co-insurance increases. So as co-insurance increases, so the nominal demand curve rotates counter clockwise, becomes flatter. So this is the nominal demand curve. By increasing the co-insurance, this is actually rotating counterclockwise, and basically by increasing the insurance from 20% to 30%, 40%, 50%, and maybe to 100%, this demand with insurance rotates counterclockwise and actually comes to this horizontal axis by 100% co-insurance. Means that in that case there is no basically insurance. The consumers are responsible for full actual cost. The other extreme scenario would be, in the other extreme side, would be when as co-insurance decreases from 20% to say that 10% and 0%. So in that case, the nominal demand curve rotates clockwise, becomes steeper up to the basically vertical line at the maximum point of the quantity of medical services could be demanded. This is maximum of 10 units, and with the vertical axis, basically the insurance pays $500 for 10 units of quantity of medical services. So when the coinsurance is zero, means that there is a full coverage. So in that case, the demand without insurance means that there is a reduction in coinsurance rate, a zero coinsurance. The nominal demand curve rotates clockwise and becomes steeper. Basically, with the zero coinsurance, the nominal demand curve will be vertical. So with the decreasing the coinsurance basically to 100% coverage, the insurance company pays the full amount. There is a zero price for consumers, so consumers are going to fully demand the full amount of the office visit per year at zero price. So in the case where the consumers has full coverage, the nominal demand curve rotates out to its fullest extent and becomes completely vertical, which means consumers use medical care as free good, when in the reality, basically, it is not a free good, right? Now, the copayment. What about the copayment? The second feature, how that change in copayment is going to change the demand. In that case, we don't have a shift or a rotation. It's a movement along the demand curve. So no rotation of nominal demand curve. The change in the copayment. Copayment is a fixed amount paid by the consumers, is independent of the market price or actual price, and does not automatically change with an adjustment in the cost of providing medical care. So it's a lower copayment, basically, is a movement along the demand curve. So with the basically with the lower copayment, there is a greater quantity of care demanded, right? So movement along the demand curve, no rotation of the nominal demand curve. So when just a correction, when we say movement down, doesn't mean that by lower copayment is moving down, means that we are talking about movement along the demand curve. So by lower copayment, we have greater quantity and vice versa. Deductibles. So deductible is the third basically element we are talking about in that impact the demand for medical care. Deductible is a fixed amount of healthcare costs per calendar year paid by a consumer before coverage begins. So basically, insurance carriers pay all or some portion of the remaining medical bill. So you have the after the deductible is met. Depends on the plan, what plan you have. If your plan says that after $2,000 deductible, then the coverage, full coverage, is up to the $10,000. Then they pay the rest of the $8,000. Now, from the insurance carrier's perspective, they think that they believe the deductible, they lower the administrative costs and they decrease the demand for medical care. Why? Because the people, they don't want to pay $2,000 out of pocket if they don't really, if they are not sure that they're going to use more than that. So until they are not sure, they don't use that. So therefore, it lowers the administrative costs. There are fewer number of the people they are using their insurance card, and also it decreases the demand for medical care. Now, the impact of high deductible health plans on healthcare utilization as cost is very important in the health economics. Basically, we wanted to know how is high deductible impacting demand for medical care. The study shows that it depends on the cost of medical episode, means that if your cost will be, say that $10,000 cost of medical care and your deductible is $2,000, so definitely you're not going to be basically hesitating to use your medical insurance, because still the difference, $8,000, is a huge significant amount. The cost of medical episode is basically determines whether you use your medical insurance and pay the deductible, and after that use it or not. The point in time is very important, because if it's December and you have to basically pay every calendar year, you have to pay $2,000 deductible, and then after that you can use your medical insurance. If you're not sure, basically you are in December, and if your medical emergency is not really emergency, you can wait, or maybe actually it's not that important. So you may actually not to use it point in time, because you know that if you pay right now $2,000, in the next calendar year still you have to pay another $2,000 deductible to use the your health insurance. You may even pay out of pocket not to use your health insurance, or even not to go to the doctor. So the point in time is very important. The probability of needing additional medical care is very important as well. If I suffer from diabetes and I know that I'm going to use frequently my health insurance, so $2,000 deductible is not important compared to the amount of the probability of needing this additional medical care. So these are all important factors affecting the demand for medical care. Moral hazard is one of the most important actually terminology in health economics. It explains the situation in which consumers change their behavior when provided with health insurance. So when you have health insurance, most of the people take fewer precautions to prevent illnesses. They shop very little for the best medical services, medical prices, and they purchase more actually medical care. So they demand more because it's the price is lower than the actual prices for them. So these are called moral hazard, because the people, they demand more medical care with when they have insurance. Because of these three reasons, they're very important. For example, the question would be here: which of the following might occur after acquiring health insurance due to moral hazard? So you may actually visit a doctor more frequently, or you may actually wash your hands more frequently, or you may actually eat healthier food and actually follow healthier lifestyle. Definitely here, moral hazard, it actually refers to the first one basically. Now actually we are moving to the non-economic determinant of demand for medical care. There are some other factors such as taste and preferences, physical and mental profile, and a state of health and quality of care, which are basically non-economic factors. They are affecting the demand for medical care. We wanted to look at them, how they are changing the demand for medical care as well. The first non-economic determinant of demand for medical care is taste and preferences. So these are including such as marital status. So a study shows that a married individual demands less medical care. At least we can say that, for example, they need less maybe hospital, stay, or length of stay in hospital, because they have somebody to take care of them at home. So they actually stay basically shorter in the hospital. So that's the case. Literacy is a little bit more complicated because educated people tend to seek more medical care. So there is a direct relationship between with preventive care, right? So they go to the routine care and so say that to basically take care of their health very, basically regularly. On the other hand, more use of home-produced healthcare services, we can say that so there is also inverse relationship between educated literacy and demand, basically. And that's, we can say that maybe they demand more preventive care and less acute care. So we can actually look at this medical care in two different, basically, angle, from preventive and from treatment and acute care. So maybe these educated people, those people, educated people, they are recognizing the early symptoms and taking care of that. So that's why they're demanding less acute care. Their lifestyle, so they are following, the lifestyle is very important for your demand for medical care. If you're smoking or you're drinking so much, definitely you're going to demand more medical care than the people they are not following, basically they are following a healthier lifestyle, right? Other non-economic determinants of demand for medical care, such as gender, females usually need more medical services than male, because of probably childbearing characteristics, and there are certain diseases demand, basically female, they are more, it's more prevalent among women, such as cardiovascular disease and osteoporosis, basically among women than men. And also, the race and ethnicity determines the demand for medical care different in different race and ethnicity. Some of the say that races, they have higher types of different chronic diseases than others. The age, definitely, as you're getting older, you need more demand for medical care. And also, other non-economic determinants of demand for medical care, such as, say that a state of health and quality of care. That's very important to control for the a state of health. Sicker people definitely demand more medical services than healthier people, and the severity of illness affect the demand for medical care. And then besides that, the quality of care is very important to, a study shows that when people, they are happy with the quality of care, so they demand more than when they are not happy. So there are higher demand for better quality of care. Basically, the demand for medical care depends on, we say that, depends on the price. Of course, not the actual price, depends on out-of-pocket price, depends on the income, time cost or opportunity cost of time, prices of substitute and complements, how you can actually find the products and services that are complement or substitute for the medical care, and the tastes and preferences and the profiles of the individuals, state of health and quality of care. These are all factors affecting the demand for medical care. As you know, the first one, the price, is moving along the demand curve, and the other factors, income, cost, time, and prices of substitute complement, and taste of preferences, and the state of care and quality of care, they're shifting the demand curve upward or downward. So the movement along the demand curve only is the change in the out-of-pocket price, and the others are shifting the demand curve. Market demand for medical care means that the total demand in the market for all the consumers or all the patients for that specific medical care. So it's a horizontal summation of the individual's consumers' demand curve in a given market. So we are talking about the market, for example, for flu shot in a specific city, a specific time period of time. What is the market for flu shot? You have to sum up number of the people they are demanding the flu shot in a specific time in a specific place, and you can get that, hey, the market demand for flu shot at this time at this market is this many, or the market price, the market demand for, say that, atypical antipsychotics. So you have to count the number of the patients. They are specifically demanding that a specific type of treatment in the period of time. So amount of medical services that the entire market is willing and able to purchase at every given price, and is, yes, like any regular demand curve, is downward sloping as the price decreasing, so the market demand increasing as the price decreasing. Now, when we are talking about the market demand for medical care, we have to pay attention to two variables. One is the intensive margin, means that how much more or less of a product consumers buys when its price changes. We are talking about the change in the demand for each consumer, right? So we wanted to see if the price decrease, how much the consumers in the market, they are going to increase their demand, or vice versa. The extensive margin is talking about the basically by changing the prices, how many more or fewer people buy a product when it's price change. We are talking about the basically number of the consumers here, not the amount each consumer is consuming. So here we are talking about number of the consumers by changing the price. Here we are talking about the amount of the basically demand for each consumers by changing the price. So you need to pay attention the difference here. So the fuzzy demand curve shows the relation between price and quantity demanded in the medical care, which is fuzzy. We don't have a straight downward sloping demand curve because of the lack of medical knowledge, because we don't have one standard basically knowledge about each medical care and services. There are so many disagreements about what treatment is the best to set a price for each medical care. And then also the consumers or patients, they lack the information to make informed choices for their actually care. So they rely on the advice of their physicians. And so basically there is a asymmetry information here. Physicians, rather than consumers, choose medical services. So here you see the consumers are patients, but the physicians, they decide about the marginal benefit and marginal cost basically. And inability to accurately measure the medical care is another case, basically makes this demand curve very fuzzy, means that we don't have one a straightforward downward sloping demand curve like any other market. we have a kind of band of, kind of market, which is the gray band represent the possible fuzziness of the demand for medical care given uncertainty and the role of the physician, basically, because in each specific price we may have different demands because of depends on the basically type of medical care, and depends on the physician's basically decision. So we don't have a regular clear demand curve. We have a fuzzy demand curve, and the gray band represent the possible fuzziness of the demand for medical care given uncertainty and the role of physicians. So we have uncertainty in the medical care, and there are two implications are associated with the fuzzy demand curve. So we are basically we are dealing with the asymmetric information in the health and healthcare services. For a given price, there are some variations in the quantity or type of the medical services rendered, and for a given quantity or type of medical services, the price differences can exist. So we don't have a specific quantity mandate for a specific price, and we have asymmetric information, which that cause the fuzzy demand curve in our medical care.